Hello, everyone. Good afternoon. I'm welcoming you to this webinar today on behalf of Correlation European Harm Reduction Network. My name is Katrin Schiffer. I'm the head of Correlation European Harm Reduction Network and also the head of the International Department of Stichting de Regenbooggroep, which is an NGO based in Amsterdam, providing harm reduction services and low threshold services to people who use drugs, but also to people experiencing homelessness or having mental health problems. Would like to encourage you, because you see this is a webinar format, to actually include and introduce yourself in the chat. I'm seeing people are already doing this. This is great. So we know a bit who is there. And you might see that there is also a Q&A section. This is for you. We will have speakers and we have a Q&A session later on. If you want to share a question, please do so. Put them in the Q&A session. We cannot promise that each question will be answered, but we will definitely do our best. And if you want to share a link or any other information, please feel free. You can also do that in the chat. So let me briefly provide you some background information about the City Initiative and this webinar. I think we all know that cities play a huge role when it comes to the development and the implementation of social health or harm reduction services. It is where cities are actually the places where most of the problems or challenges or things are happening at first, and it is also where we see that new interventions are being tested, innovative interventions are being tested, but unfortunately also less productive interventions sometimes. And despite this important role of cities, we also see that cities are not really sufficiently involved at policy level, in national policy level, EU policy level or global policy level. And this was actually the reason why we thought at Correlation we should somehow have more focus on cities, and we initiated the City Initiative on Drug Policy in 2024 with this idea in mind, to have actually not a huge or formal network, but to have a place or a platform for exchange, to exchange and inspire each other, share knowledge, learn from each other, improve understanding on what is going on in the different cities, support cities also in developing new interventions, also by building on interventions in other cities, and also in working together. Today's webinar, I think we do exactly what we want to do. We have invited a group of outstanding experts from different cities with different experiences. Idea is that they can share their ideas and their work at city level, and that we can learn from what they have been doing and see if parts of these interventions can also be probably implemented in a different way or inform local drug policies in a different level. The webinar will be chaired and moderated by my dear colleague, Noor. She has been coming to our organization in the beginning of this year, but now I would say she's an indispensable member of our staff team, because she has really worked super hard in this year, and specifically also in the work related to the City Initiative. She carried out an online consultation which included, I think, 18 different cities, organized calls with all these cities with different representatives. They shared what they experienced, their challenges, needs, gaps for services, but also what they can contribute and where they're good at. A report has been produced for that. I think we can share that later on in the chat. But also this webinar, I think, is a direct result of the work Noor has been doing in the past months, and she has also been organizing the whole webinar. So I'm really happy that she did this in such a good way. We have actually really good speakers, distinguished speakers. First of our speaker is Marius Atzemis. He's a leading harm reduction expert and currently serving as deputy chair of the Addiction Prevention Centers, Athena IGEA. I'm sure I did not say it in a good way, Marius.
No, it was nice. It was a good effort.
Yeah, and a good effort.
Yeah.
So he is a board member of both the Drug Policy Network of Southeast Europe and also Correlation European Harm Reduction Network. He is a regular lecturer for the Medical School of Athens and a well-known speaker at all kind of different international conferences when it is about drug dependence, harm reduction, humane drug policy. And today he will present the Municipality of Athens' new action plan on drugs for 25 and 27. And I think it's nice to see Marius has been an NGO representative for a very, very long time, and he is now a city representative. And I think it's great to have someone in the city with the background from NGO. Second speaker is Insa Hol, who works at the Berlin Senate Department for Science, Health and Care. She has a background in health science and a master's degree in public health. Insa coordinates responses to drug and addiction across the city. And before joining the Berlin administration, she worked directly in drug counseling and addiction prevention services. Today, she will share insights into Berlin's new citywide drug monitoring system, including how it is being set up and how it fits into a broader urban strategy. And our last speaker is Andrea Weiß. She is the head of the Division for Protection and Prevention in the city of Zurich for the past 4.5 years. She has more than 15 years of experience in public administration, holding various management positions in the fields of asylum, labor market integration, and harm reduction. Her division is responsible for drug consumption rooms, drug checking, low threshold meeting points, counseling for sex workers, outreach, social work, and conflict management in public spaces. And today she will present the 4-pillar model and the cross-departmental collaboration that supports it. So, all in all, I think 3 great speakers, a wonderful moderator, and this is now for me the time I give the word to Noor, and I wish you all a wonderful webinar. Thank you so much.
Thank you, Katrin. Hi, everyone. It's lovely to have you all here. So we'll start the presentations with Marius. In terms of the Q&A, I ask that feel free to send questions during the presentation. We will do all the presentations first and then go into the Q&A afterwards. But in case you don't want to forget a question about the first 2 presentations first, feel free to send them in and we'll try to address as many as possible. So now, Marius, I will hand the floor to you. And
thank you. And you helped me as we said with the changing of slides. But before presenting the Athens Drug Action Plan, I would like briefly to share with you the vision behind it. Our vision is to build an Athens where all residents, regardless their social or health status, can live in safety, health, and dignity. A city that does not tolerate preventable deaths, extreme marginalization, or the abandonment of entire neighborhoods, but responds with responsibility, evidence, and humanity. For Athens, drug policy is not an abstract debate. It directly affects public space, social cohesion, public health, and everyday life in the city center. Open drug scene, homelessness, mental health challenges, and infectious diseases such as HIV and hepatitis C have placed enormous pressure both on vulnerable people and on local communities. These challenges require urgent and coordinated responses, not short-term or fragmented measures. We envision a city center that is no longer a space of exclusion and neglect, but a place that is safe, accessible, and sustainable for everyone. A city where public order and social cohesion are strengthened through integrated prevention, harm reduction, healthcare, and social inclusion policies, and where the right of residents to live in safe neighborhoods goes hand in hand with the rights of people who use drugs to access health, support, and recovery services with dignity. This is precisely why cities matter. Cities are where drug policy becomes real. They are where lives are lost or saved, where tensions escalate or are resolved, and where innovation can emerge faster than a national level. This understanding is at the heart of the European City Initiative on Drug Policy championed by Correlation Network. The initiative recognizes that while national and EU strategies are essential, local actions often lag behind, despite cities carrying the greatest responsibility. By bringing together mayors, local policymakers, and civil society, this initiative strengthens city-level leadership, knowledge exchange, and evidence-informed approaches to drug policy and harm reduction. The Athens Drug Action Plan is our contribution to the shared European effort, a city-level framework aligned with international standards, grounded in evidence, and driven by the conviction that public health, safety, and dignity must advance together. Let's go to the second slide. Okay, so as you probably imagine, the presentation is about how Athens moved from fragmented responses to a coordinated health-led urban drug policy, aligned with international standards and grounded in local reality. And this is why this action plan matters. It's the first comprehensive drug action plan in the history of the city of Athens. It's a health-led, evidence-based municipal policy shift. For the first time, Athens has a single, comprehensive framework that treats drug policy as a public health and governance issue, not as an emergency to be managed ad hoc. Let's go to the other slide. Why international alignment? It's built on WHO, UNH, UNODC, and the EU drug strategy. Evidence, human rights, and public health as core principles. This alignment matters because cities need legitimacy. This framework gives us evidence, human rights safeguards, and a common language to act responsibly. Slide 4. A changing reality in Athens. There is a rapid transformation of the drug scene and social vulnerability, overlapping crises requiring coordinated responses. What we see today is not only problematic drug use, but overlapping crises, homelessness, mental health, and infectious diseases, all very visible in public space. Let's go to the next one. So there is a new role for the city, for fragmented actions to municipal leadership, drug policy as a public health and social inclusion policy. This required a clear political decision. The municipality must lead, coordinate, and take responsibility even within very limited competences. Slide 6. The structure of the action plan is 4 strategic pillars guiding all the interventions: prevention, harm reduction, care, and social inclusion. The action plan is structured around these 4 pillars that connect prevention, harm reduction, healthcare, and social inclusion into one coherent system. Let's go to the next one. Prevention and early intervention. Okay, prevention is about reducing vulnerability early, strengthening communities, and intervening before harm escalates. Pillar 2. Yes. Harm reduction and overdose prevention. Overdose prevention is a central priority. naloxone is treated not as an exception, but as a core public health tool. For the first time in history of the city, we are preparing and educating the frontline workers for approaching drug users and distributing naloxone. Partnership for Healthy Cities. This is our collaboration with the Bloomberg Philanthropies DAS Vital Strategies. The Partnership for Healthy Cities helped us move faster from planning to implementation with a clear focus on measurable public health outcomes. Naloxone as a policy choice. Naloxone represents a political choice, actually, that preventable deaths are unacceptable and that every life matters. Health and continuum of care. It's linking harm reduction with health services, which is not always the case where I come from, and addressing HIV, hepatitis, and mental health together, which is also not the case where I come from. Harm reduction is effectively when it is linked to health systems and continuity of care. Social inclusion and urban governance. Drug policy, in our case, is also an urban policy. Public space, housing, and social support must be part of the solution. Why this matters for European cities? The Athens experience shows that alignment with international standards empowers cities to act. It does not restrict them. And here we are. I have this is our political closing. Okay, you can read it. I have also, just to add for the final, my closing remark is cities in Greece are often asked to manage the consequences of drug policy, but too rarely empowered to shape it. The experience of Athens shows that cities can lead even in complex social and political environments when they choose evidence over fear and health over exclusion, aligning with the best practices, the international drug best practices, the European Drug Strategy, WHO, UNAIDS, and UNODC. It's not like a technical exercise. It's a political choice to protect life, dignity, and social cohesion. Through the European City Initiative of Drug Policy, cities can move from being implementers of national decisions to becoming drivers of innovation and change. Athens has made this choice, and we believe that together, European cities can protect and save lives, reduce harm, and build safer, more inclusive urban spaces. Thank you for your attention.
Thank you, Marius, for that presentation. We'll move on to Insa now.
Thank you. Yeah, thank you so much. Can you hear me?
Yes, now perfect.
Perfect. I will talk a little bit about the monitoring of synthetic opioids in Berlin from my perspective of the state administration or ministry. And the monitoring system fits into our new strategy for drugs and addiction in Berlin that is being worked on right now. It has similarities with the 4 pillars that Marius just described, but has some more. But important for the monitoring system is that harm reduction is very, very important in the strategy, and also that we are planning to do more based on data that we have and trying to collect more data. So this aligns well with the monitoring system. We need a monitoring system because we are expecting that especially synthetic opioids could play a more important role in Berlin. And we are focusing on the synthetic opioids at the moment. But of course, we plan to extend the monitoring system at some point. One problem in Berlin is that Berlin is pretty big. I imagine that if you're in a smaller city, it might be easier to detect clusters. But Berlin has many, many clubs, many emergency rooms, etc. So we have to bring everything that we know together to not miss any clusters. And that is what we are trying to do. We are not starting from zero in Berlin, so I would like to give you a short overview on what already is in place in Berlin. We have drug consumption rooms across the city, stationary and also mobile units that operate across the city. And we also have drug checking implemented. But very important that we still have to work on the legal framework, and we are doing it right now in order to also be able to offer drug checking in the drug consumption rooms, which is so important, because at the moment we are only reaching a certain target group with our drug checking program. It's mainly younger people from kind of like the party consumption scene, and not so much the target group that would consume drugs in the drug consumption rooms. Not long ago, we were able to finally start an naloxone distribution project, which is so important in this context too, and which just got prolonged until the end of next year. So we are happy about that. And we also have a prevention project in the club scene, which provides informations on and tools for mainly safer use, but also safer sex. And we would love to also implement drug checking in the club scene directly, but we still lack the legal framework, as I mentioned, and also the resources so far. So now we're getting to talk about the monitoring system. The following two topics are important for that, which is the nationwide project called SOPA, which stands for Synthetic Opioids Prepare and Response. It's a project that 3 German cities take part in, namely Berlin, or to be more precise, the inner district of Berlin, and Hanover and Essen. And the main part of the project is a rapid testing phase beginning next year in order to get an idea of synthetic opioids being present in the substances that are consumed in the drug consumption rooms, and following also implementing a reporting chain in the system. So it's also kind of like a monitoring system, and thus goes hand in hand with what we have planned in Berlin anyway. And in order to implement the monitoring system, we established a roundtable on synthetic opioids. I think the roundtable is the backbone of the entire system, because it's something that we cannot solve within the Ministry of Health alone by ourselves. So we have a cross-sector membership with many people that are taking part, many institutions. It's not just us, and not only the service providers of the harm reduction services in Berlin, but also the police, the criminal investigation office, hospitals, the university hospital research groups, the fire brigade and the first responders, and many more that are taking part. And I think it's very important that we come together cross-sector to talk about it. And there we align what each of the persons taking part already know, which data they have, because they know a lot. And we are talking about how we communicate with the public and how we want to warn in case of clusters occurring. So that's kind of like the tiered warning system. And we are also talking about specific scenarios that might occur and when we call something actually an incident, like having a threshold to a cluster. So one scenario could be that there are overdoses in the drug consumption rooms, for example. But I'm pretty sure that if something occurs there, the service providers will call us. They just give us a call. For example, Astrid Leicht, who is here today too. I'm pretty sure if she says, we have been observing something and we think something is going on, she will just give us a call, and that will work pretty well. But we still have to define and specify the steps. But more important, we are talking about how we actually get to know something is going on if it happens somewhere else. For example, in clubs or in the street or something else. How the monitoring will work, we will see. I think we don't have the one data that will let us know something is going on. So we have to take more like puzzle pieces in order to know that there's something going on. We implemented a functional mailbox where the members of the round table and also other professionals can let us know if something has been happening in their field. And I also want to give a short overview of the data that we might have, might be able to use, or also not, that we are not able to use. We have the emergency service, the ambulances, and I would hope that for most of the overdoses, they will call an ambulance. But the problem with the data from the emergency service is that it's only available delayed, maybe like 24 hours. So that might be too late to actually respond to a cluster occurring. We get the information on the drug-related death by the police, but this is also way delayed. We cannot use that for monitoring. As I mentioned, we have the information from the harm reduction service providers. We get other information by the police and the criminal investigation office if they, for example, find drugs. And we also want to use information by other players, as, for example, the homeless shelter providers. And question marks, other data are also welcome, and we have to take the different pieces to a bigger picture. The main output is supposed to be a tiered warning system. So we want audience-specific messages depending on the incident, on the cluster, where it occurs, and who needs what information. On the right-hand side, you see an idea of the different levels that could be identified. So if it's just a small amount of overdoses, it could be just a heads up to the harm reduction services. And depending on how many cases we have, it could also go up to a public warning to let as many people as possible know that something is going on, for example, on the Berlin Metro or similar. Exactly. So we have been facing also a couple of challenges, just very short to end with. As I said, many of the data is only available delayed. We have been talking about double counting because in theory, it's possible that the same incident is appearing in different systems and could be reported more than once. It hasn't happened so far as we can tell, but still this is something we have to talk about. And we have not agreed on a threshold, like when we will actually warn, when it's just a heads up, when is it a public warning. This is something we have to still define. Thank you so much for your attention.
Thank you, Inza. That was a lovely presentation. I would like to remind everyone that if you have any questions about the presentations, please don't hesitate to put them in the chats during. And last but not least, we'll go to Andrea now.
You can hear me?
Yes, perfect.
Yes. The objective of the four-pillar policy is to reduce drug use and its negative consequences. The four-pillar of drug policy are not only implemented in Zurich, but have also been enshrined in Swiss law since 2008 in the Narcotics Act. That's important to know. Here you can see the four pillars. The first pillar is regulation or repression. Not like in Athens, we have defined it a bit differently. It's mainly by the city, done by the city police. Then the second pillar is harm reduction. That means supervised consumption facilities, drug checking services, drop-in centers, also housing offers, etc. Then we have the third pillar with the treatments. It's like opioid-assisted treatments, outpatient clinics, and addiction clinics, and the pillar of prevention, mainly outreach, social work, and yeah. The city of Zurich is providing some services herself, but many services are provided by private organizations like NGOs having a contract or agreement with the city of Zurich. In the city of Zurich, we have currently 3 DCRs. 2 of them are in the city center. One is a bit outside, located a bit outside of the city center. And since October 2025, we have got a room for consumption and triage, which was opened exclusively for crack consuming people from outside Zurich. The consumption rooms have overlapping opening hours from early morning, 7:30 until 8:30 p.m. More than 1,000 users are frequently using our facilities. You can see the pictures, which I'm showing now. This is the newest opened drug consumption room. We have opened just in October, but another one I've told you before, another one. And 3 supervised drug consumption rooms, as I told you before, which are offering supervised consumption of illegally acquired drugs brought in by users themselves, such as cocaine and heroin, inhaled, intravenous, and sniffed. We also provide medical care and promotion of hygiene, cheap meals, restroom, social counseling, crisis intervention, hourly wage employment, etc. What is very important is that we, that's what I want to tell you after. The capacity of one DCR is up to 65 people at one time. Many clients spend the whole day in the DCR. Microdealing is tolerated in the facility, in a specific zone of the facility. Why is that? It is because if it takes place indoor, inside the drug consumption facility, it does not take place outdoor in the public space. The 2 DCRs, which are in the city center, are within walking distance of each other, what is quite important. We give access for people with proof of residence in Zurich. And we have around 100 people who have hardship permits to get in because they originally lived in Zurich. Here you can see the inhalation room on the left, and you can see the outdoor space, which is also with the sun shelter. In the backside, you can see that's the microdealing zone, and on the right you can also see the restroom. In spring 2023. a small open drug scene, up to 50 people, developed in a park called Bäckeranlage in the city center of Zurich. And this park is also very close to to 3 different public schools. The users smoked crack in the park. There was stealing in the park and a lot of littering. The park is located in a residential area. The coexistence between residents, children, and other users was not possible anymore. And people from the neighborhood, they felt insecure and afraid. The situation required a rapid and coordinated approach involving all stakeholders. The measures were developed in working groups from different pillars and professions, such as police, social work, social culture, and city cleaning. This slide shows an overview over all the different measures we took. The city police formed a special unit and increased their presence and repression in this area. The outreach workers were on site several times a day and implemented a longer time of presence. The cleaning of the public toilets has been increased to several times a day to keep the park attractive for the neighborhood. And we also made training of teachers and classes by addiction prevention teams and people who worked in the outreach work. And the goal of the whole measures was to a restoration and improvement of the coexistence of all the users of the park. And what was very important is that we had a coordinated communication with the media or towards the media, because these different pillars, these different measures, they were developed together, but in different departments of the city of Zurich, and the media normally ask the same questions in different departments, and you have to coordinate the answers very well together. This slide explains how is to explain the across departmental coordination. On top, we have the delegation of 4 city councillors of the 4 departments of the 4 pillars. That means the security department, the health department, school and sports department, and the social welfare department. This delegation is responsible for the city life in public spaces and is also called like that. They are like the head of all the working groups, this delegation with the 4 councillors. And the working group, you find them in German on this slide, but just I will explain them for you. The working groups are called substance consume in public space, youth in public space, youth parties, prostitution, and some other working groups. Some working groups are more on an operational level, some on strategic level. The issues are coming usually bottom up, from operational to strategic and political level. All the groups meet regularly, around 4 times a year. For a bit an overview, you find here some key figures of my organization. Some key figures of our harm reduction facilities in Zurich. It's on the left, it's the social outreach work with over 13,000 interventions in a year in public space. Then we have more than 4,000 substance analyses in the drug checking, and we do all the substance warnings for whole Switzerland from all the drug checking centers. And we have over 300,000 consummations which are passing or which are done in our supervised consumption rooms. 80% of them are normally smoked crack. A very important part of the solution is that we have a substance use accepting housing offers. This means that you are allowed to consume illegal drugs in the housing offers, or in the housing in your room or in your apartment or in the emergency shelters. And to make a short conclusion, let me repeat some success factors of Zurich. It needs several consumption facilities with overlapping opening hours. We tolerate micro-dealing in some in consumption facilities in consultation with the police. That's very important. The principle of zero tolerance in public space regarding dealing and also consumption of illegal drugs is very important. Then we have the consumption facilities must be adapted to the needs of users so that they stay or longer in the facilities, that they spend more time there. The involvement or the communication with the neighborhood is very important. Regular exchanges with them. As I told you before, consumption accepting housing facilities and outreach, social work for networking, triage, conflict mediation, and the close cooperation between police and social work, and also the communication on equal terms is a big key. I hope I was able to give you some brief insight in the Zurich system, and thank you very much for your attention.
Thank you so much, Andrea. And thank you to Inza and Marius also for your presentations. We'd like to now open up the Q&A, and I see a few questions in the Q&A section, but I also had a few questions that also slide into those in the chat. The first one being from Marius, also relating to the question by Rui. How have you been able to implement progressive and international aligned drug policies into conservative contexts and also translated these international guidances into practical measures that fit the context of Athens? That's the first question for me, also relating to Rui's question. So Marius, would you like me to repeat it maybe?
Yes. Can you repeat it? Because I was also watching the questions in this thing that I cannot close right now.
Yeah.
Always there is
So
this
I'll
kind of
divide Rui's
issues.
question into two parts.
Yeah.
So the first part is to...
it's about implementation.
Yes. So implementation of also international guidances and practices into the context of Athens, but also into more conservative contexts, as the example of Portugal was given.
Yeah, okay. First of all, about implementation, because this is like a question that needs two answers. Well, the first implementation step was to establish a clear governance and coordination framework at municipal level. Before launching new actions, we focus on aligning all relevant department services and partners around a shared vision, common principles, and clear roles. In parallel, we carried out a rapid assessment of the most urgent risk on the ground, particularly those related to overdose public health and pressure on public space. This allowed us to move kind of quickly from strategy to action without losing any coherence. In terms of prioritization across the 4 pillars, we follow the phased and risk-based approach. Now, about the international guidelines and how we can implement it on a city level, you know, for us, for Athens, first of all, I have to say here, giving this answer, that I'm really humbled when I hear colleagues from Zurich and Berlin and talking about their so developed structures and their so humane drug policy. And I have to admit, as a harm reductionist, as a peer, and now as a city representative, that we are very far away from the cities. We are like million light years away from this cities. It's the first time that actually Athens has a concrete action plan on drugs, while other cities are working on that like 30 years now. So it was kind of a life-saving recipe to translating international guidelines into local action, moving from abstract principles to concrete tools for frontline practice. And our priority was to ensure that global standards were not only reflected in policy documents, but embedded, you know, in everyday municipal work, which is very difficult sometimes. And one of the first steps was the introduction for the first time of a structured information and training sessions for municipal frontline workers. And these sessions with the Partnership for Healthy Cities, this is part of the Vital Strategies project, are focused on problematic drug use, bloodborne infections, and overdose risks and overdose response. This approach is directly aligned with WHO and UNAIDS. And there's another thing is that, we adapted an international guidance to the specific urban reality of Athens, a dense city with visible drug scenes and high pressure on public spaces, city committees with residents enraged. And this meant prioritizing low threshold and harm reduction oriented interventions that can operate with municipal structures while strengthening coordination with health and social services. I don't know if I covered you. I can speak for about an hour about all this, but I would like also to answer to my peer from Greece, from Athens, from Orpheus, that actually asked me, sorry, Mr. Yorgos Zarkotos, that actually asked me how do you have any, as municipal authorities, any plans to use peers and peers-led? The answer is yes. We have started with Positive Voice for HIV and hepatitis, basic things. I have started myself introductory seminars for harm reduction and for naloxone distribution to the municipal street work and to the frontline workers of the medical units. That had never happened before in the history of the city, and the frontline workers, they didn't even know by name what naloxone is. They didn't know even, and they were very excited and very happy for starting all these initiatives. And yes, we are going to embody drug users unions and other peer-led organizations. This is our plan, actually. Okay. So this is my answer to Yorgos.
Thank you, Marius. We also have a question for Insa. So in your presentation, you talked about thresholds to a cluster scenario. What guidelines are you using for this, and how are you managing with coming up with guidelines for these clusters of scenarios?
Thank you for the question. I do agree that it is very difficult to manage, and that is why I said that we do not have defined a threshold yet. So this is something we have to define, that we are working on. I am not sure how we will do it, or if we will just have to continuously adjust the threshold to see what works best for Berlin. But if anyone has any idea on how to define a threshold, please let me know.
Thank you, Insa. Okay. Another question here from Thijs. A general remark. I think we're facing similar challenges in Amsterdam regarding drug checking in consumption rooms or developing effective approaches for drug-related nuisance in public spaces. It would be interesting to further explore similarities as we're trying to develop new local policies like you did. Okay, so this is for an exchange of contacts that we will do, and we'll also be able to, Katrin, yes?
Sorry, it's just because Thijs was mentioning this now, and when I heard indeed from Zurich this description of the park, it really popped up. I mean, we have a similar situation also in the park. I know other cities in Germany, but also in other European cities do face an increasing number of open drug scenes again. And I was in a meeting a few months ago in Germany, where they talked about, they called it tolerance zones, which is a bit a weird terminology, because the only thing was that in the rest of the city, it was not allowed to hang around or to use drugs. And in this area, it was just an area where people said, we are not really interested what happens here. And these as you can imagine, were not the most safe places in the city, very often slightly outside of the city center, badly accessible, without any kind of harm reduction support. So I'm wondering, because this reminded me a lot about Platspitz and also about many, many years in the 90s back in the Netherlands, where I saw that there were places where people who use drugs were staying there, and there was a really horrible situation partly. So I wonder if you see that as well. If you see, does it mean that there is an increasing number of people on the streets using, which we cannot serve with all the services we have, especially in countries which are well developed like Switzerland, Germany, Netherlands? I'm not sure if it's clear what my question was.
Are you asking me?
I'm
Yes,
asking,
or
yeah,
everybody?
Insa, Andrea, also Marius, if he wants to join. But
We see that. We see that the number is increasing. Number of people without homeless people, is increasing also in Zurich. And also the number of drug consuming people is also increasing in Zurich. We are more or less able to handle it, but we have opened recently emergency housing for women, just for the winter time. And yeah, our capacity of our DCRs, the capacity is limited. So that means we need, in fact, a fourth DCR. We are already looking for it, but we haven't found yet. It's quite difficult, as you know. But yes, the increasing is visible. Yeah. But we have the strategy not to leave the scene somewhere outside. So we want to handle it in doing harm reduction inside our DCRs and being quite repressive outside in the public space.
To add to that question, maybe, and directed to Insa and Marius, Di Pino also asked a question in the chat just now that relates to this, of do your strategies to combat this, also police responses in the street and public drug use, do they also include decriminalization and tolerance as a public policy, or are those mentioned in the strategies that are used by the cities?
Well, sorry, please proceed.
Thank you. So we do get reports that drug consumption is more visible in public spaces in Berlin too. And as Andrea said, we also want to address this problem mainly with harm reduction. But we also do believe that the public space is for everyone. So it is not just for everyone, but drug consumers, but also for them. So we are trying to think about how everyone can have a space, a safer space, to do what they want to do in public spaces. Regarding the question from Pino, we do not have micro dealing allowed in the drug consumption rooms, as for example in Switzerland and Zurich, which we would like, but don't see that coming. That is not politically wanted so far. But also regarding the strategy that we are working on right now, decriminalization is a big topic that we want to address, which does not mean legalizing drugs or anything, but that we try to make sure that people who consume drugs, and especially people who have a problematic consumption behavior, do not get criminalized by having to go to court for having what they need just for themselves. Of course, we still want dealing to be illegal in the street and on bigger scales, but we really do not want consumers to be criminalized.
Thank you, Insa.
I will be very, honest answering this question. I'm a harm reductionist, a former drug user, a supporter of a humane drug policy, and I'm really pro about decriminalization in any form and in every aspect. But I am not alone in the municipality. And Greek society is a very it's a very conservative society, and there is a lot of moral panic around drug use issues. Also, at that point, I've been continuously attacked by the tough love rehabilitation units because I exposed them on the Greek television. And one of the things they say about me is that as always, they say about harm reduction is that I'm promoting drug use and blah, 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 blah. Okay, so decriminalization is not mentioned on the action plan of the municipal authority, but it's also, if I can give you also a technical answer, it's beyond the city's capacity to decide what is criminalized and what is not. It is very clear from the action plan that supports a sustainable and humane drug policy beyond punishment measures. But decriminalization goes to the central government and to the people who support the central government, the Ministry of Justice, the Ministry of Police, the Ministry of Health, blah, 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 blah. Okay, so that's my answer.
Thank you, Marius.
Maybe I have to add just for a second that we are not there yet. This is what we are discussing at the moment, and this is what I think would be the right thing to do, and my boss thinks so, and the Senator for Health thinks so. But this has to be discussed on the Senate level, and we will see if we get what we want.
Sure, thank you. Keeping time in mind, we have maybe one more question that I'll address to all three of you. Maybe we'll go a few minutes over. So this is again from Hui. How can European cities develop effective cross-sector data monitoring systems that not only track drug use trends and support emergency preparedness, but also prioritize and integrate insights from peer-led organizations? So how can we ensure that within these monitoring systems, we're also using knowledge from lived experience and people who use drugs, and not only having these systems being treated as institutional data and being kept to the side. So I'll open this to the three of you, maybe up first.
Okay, I can start. That's a very good question because you're talking about monitoring and what is going on. So the thing is the following. There is a gap between the official details from the Greek focal point, who is also the representative on the EUDA organism, okay, and what is going on in reality. And this is not a matter that someone is lying. It's a matter of methodology. As a municipal authority, we work close together in this overdose prevention project with scientific companies, top leading epidemiologists, and also peer workers. And we have a methodology. They have actually. I'm not an epidemiologist. They have a methodology to measure the overdose deaths, the non-fatal overdose incidents, and also HIV and hepatitis transmission. And there is a huge gap between the monitoring of this scientific top leading scientists in Athens with the focal point in Greece. So in a way, as a municipal authority, we have a system to measure things. But we have a long way to go for measuring other things than overdose deaths or bloodborne infection transmissions.
Thank you, Marius.
I think I've been very honest in this webinar. I don't know if this works okay with me. If it works,
will all be recorded, Marius.
I know.
Okay, maybe Insa or Andrea, if you have any last remarks regarding that question.
I think we have not that much data. We are starting now to have more data. But what we do is we talk very regularly to our consumers, our clients, and we are every day. And we also have like talking groups where we know, or we like hear the opinions of the users. So we are in very close contact with them. But we don't do it in a structured way, more in a quality way.
Thank you, Andrea.
I think it's similar in Berlin too, as Andrea just described it for Berlin. But I do think that there are consumers in Berlin that we do not reach with professional help. So neither they show up in drug consumption rooms, nor we can address them with street work or something. So it would be very interesting to get more insight on the information that the consumers have. But to be honest, since this is a very honest webinar, we have not implemented a way to actually get information from them.
Thank you. Okay, thank you so much to the three of you. Marius, do you have any last things to say?
At your surprise, no.
Okay.
I'm totally
I
fine.
thought I
I'm
saw
very
you.
no, no, no. I was just watching some other questions, but I cannot answer to them. Like a friend from Pakistan asked me how many people from Pakistan are on the squares of Athens using drugs. I cannot give a precise number about that. We know that this is happening, but I cannot measure that. But I have to thank you for this opportunity given today to present the action plan and exchange some ideas and practices with you.
Thank you. And thank you, Andrea and Insa also. And thank you to everyone who joined this session. I hope you enjoyed the presentations from all three of our speakers and their honesty. So a few technicalities now. We will be sharing the recording of this webinar on our website, so you can share it with colleagues that maybe couldn't have made it. In the chat, you will also see that we shared a report that was written for the European City Initiative on Drug Policy. And this is a report based on the consultations that I've held with all the cities participating that Katrin mentioned in the beginning. If you would like to take a look and learn a bit more about the initiative and the kind of actions that we recommend and work that we're doing. Yeah, thank you so much for joining. Thank you for taking this time this afternoon to be with us. And yeah, we hope that you join the session and have a good evening.